Assessing if you need in-home care, toileting. This is another issue that's essential for day-to-day life. There's a few points that I want to go over with toileting. I don't want to embarrass you, but only be helpful to you in planning how to maximize your independence. I want to begin by asking the question, is a raised toilet seat, a toilevator, or a toilet support frame needed? So a raised toilet seat and a toilevator provide the same functionality. They raise a toilet about 3.5 inches higher. The reason is it takes stress off of your hips. So this is essential for hip replacement surgery. A raised toilet seat sits on the toilet. A toilevator mounts on the floor and is like an elevator for your toilet, permanently raising it up. The difference between the two of these is cleaning the toilet bowl. It's easier to keep the toilet bowl clean if you're using a toilevator, what mounts on the floor. A raised toilet seat tends to get very dirty because of the mist that occurs when flushing the toilet and needs to be regularly cleaned and sanitized so there's not bacteria on it because of obviously bladder and bowel movements. Now, this may not be an option for everyone. You may be someone that's lost bladder or bowel control. In that situation, there are adult briefs. Why the word brief is used is to symbolize underwear that's used with an adult. I do not like when they're referred to as diapers, and the reason is a matter of respect and dignity for those who rely on these products. If you do need adult briefs, there's no shame in it. Work out what system is best, and as well as keeping your genitals clean from relying on this method. Would the use of a urinal or bedpan be of help to you? So I use a male urinal during the nighttime hours because of being at risk for falling. That is that my hips still get very stiff at night, and if I was to head to the toilet, like the bathroom, there'd be a very real risk of me falling. So then in the morning, the urinal is cleaned and sterilized, and then I wash my penis in the morning also to keep it clean as well. So you need to think through what system is needed that will work with your scenario and your situation to manage bowel and bladder. And then with dignity, I encourage you to walk it through. One of my home care workers told me of an MS patient who had a bowel movement while she was being bathed. And you know, the personal support workers, when they're needed in the home, they're there to be of help, and there's nothing to be ashamed of if this should happen to you.